we want to be able to have a final agreement on the structure of healthcare by the end of this year, and that we want to have the new regulations drafted and approved in Parliament before May or June, and then we want to be able to implement the new health insurance and the new processes within healthcare by the end of 2019.
We need to come to terms with the fact that we are in a healthcare crisis, and this government is trying to find a unique way to both run our hospital in a way that it can be economically viable and also offer the services it needs to the St. Lucian public. We're looking right now, consulting with several different entities, providers, in terms of the best policies to cover an entire country and the way forward. This is actually going to be a pilot in St. Lucia for the OACS. So we will be looked to as, you know, the litmus test as to whether this can actually work. You know, so we're basically going to be a pioneer in this area. The national health insurance would basically mean that we're looking at coverage, let's say, to about 80, 100,000 per person. And this would mean that St. Lucians would have certain health things that are totally covered, certain number of doctor's visits, there would be certain procedures that would be covered as well. Some of your medical supplies, those kinds of things. I mean, we're still working out the details.
I don't want to be accused of repeating myself, but it's important. Every day and every new service that we put into OKEU before the health insurance comes in is at the government's cost. Right? So if in fact we were to fully operationalize OKEU by the end of this year, which is what the intention is that will be on the P&L of the government.
How do we create this public sector, private sector partnership that's not necessarily exclusive to one entity, but it would be available to multiple entities, in order that our medical fraternity here could feel that this is not in any way threatening them? That is who we have to be able to work with. Our government has said repeatedly, we're open to discussions. So we're hoping that through dialogue and our commitment, and to never lose sight of who this is supposed to be for. This is about the people. But more important, this is about the more vulnerable people in our society who have been deprived for years, have not had that access. This is for the families who have lost money and now will no longer have to confront those decisions. This is about putting St. Lucia on a world level. This is immediately improving the quality of life of St. Lucians, that they're going to have access to healthcare. The goal is to have all final decisions made by the end of this year. So how it's going to be structured, what's going to be the architecture of all the organizations. So what we've seen elsewhere in the world is that to keep healthcare insurance costs down, that we must have fixed prices on services. So exactly how you have a NERC for utility companies, that all the prices have to be agreed to if there's any increases, is the same thing we're proposing to do in healthcare. We're also talking about having now a national health care authority, and that entity will now certify all of the facilities in healthcare, including the hospitals, and also review cases so that we are monitoring how doctors are prescribing and how the system is working to make sure that there's no abuses, so from a regulatory perspective. Once we've worked out the architecture as to how that's going to be, then between the months of January and June, we'll be now doing all the legal drafting, getting the drafts out, allowing everybody to review them. But the goal would be that by sometime in the summer next year, to go to Parliament and pass all the necessary legislation. We would then hope to have now insurance policies implemented by no later than the end of that year. So by the end of 2019, everybody will be insured.
We are going to be looking at a package of goods. These goods will be priced, and maybe sometimes that is why you're getting the negative backlash from some medical practitioners in St. Lucia. Because right now, personally, I believe a lot of the services that we get from some of our medical practitioners, these services are priced out of pocket. Many people, myself, cannot afford some of these services in St. Lucia. I go to Martinique and I get cheaper services. I can pay my transportation, go to Martinique, do certain medical procedures, and come back here, and it is cheaper than me getting that service here. So that package of goods is going to be priced, and doctors will not be able to charge different prices for the same thing. If you have a finger that needs to be amputated, it's going to be one price. If you have a finger that needs to be amputated, it's going to be one price. So
the roadmap is expected to be completed within this financial year and will provide clarity as to the direction government should pursue. Marcus Bazan is a technical consultant expert with SocioPlus. He is a health economist with over 30 years of experience on a national and international level. He stressed that consultations with as many stakeholders as possible is imperative in the formation of a national health insurance scheme.
There are two basic rules for a good healthcare reform. It has to be very well designed and very well funded. If one of those things are missing, you might have a good system but badly funded, it wouldn't get you forward. You might have a well-funded system but badly designed, and this wouldn't help you either. So this is the best advice we can give, that both of those strain has to be complementary and well harmonized. And this is the reason why we like to bring together all people relevant in this process in order to have a common aim, a common target for the good of the people of St. Lucia.
The technical consultants acknowledged that national health insurance schemes have been difficult to implement around the world, citing examples such as the United States and the United Kingdom, but said, however, there are successful programs which can be cited as examples.
On the other hand, you have very small countries like Denmark or Switzerland or the Netherlands, where you have a common sense and a common target, and thus you don't have so much resistance within the population and the stakeholders, because everybody gives in a wee bit and everybody gets out something of it. And this has to be the process, and this is tough work to persuade the other side always.
You're complaining that people are attacking your wife.
I have no intentions of answering any questions you ask me. I said I have no intentions of having any conversations with you.
I just want to ask a quick question about the National Health Insurance White Paper that was supposed to come out last October. Can you tell me who is working on that, and do you know what the progress is so far?
Any other questions?
About the National Health Insurance White Paper that was supposed to come out last October. Can you tell me who is working on that, and do you know what the progress is so far?
So I want to just take an opportunity to explain that this difference. When we speak about universal healthcare, we speak about bringing healthcare to every single individual, ensuring that we understand the epidemiological profile, what is making you sick, the demographic profile, who are our people in the population, what is the percentage of persons in various age groups and gender, and how do we ensure that that health system is responsive. We went one step further to establish the essential package of health services. But I also want to say that the universal healthcare approach that the government, the St. Lucia Labour Party, identified at the time that we drew up that plan spoke to not only providing care, but building a system to sustain that care. So you could not ensure that your healthcare services would be sustainable if you didn't have a proper governance structure, if you didn't have a financing mechanism, if you did not, in a very cost-effective way, right, identify what were the key services that were necessary so that you didn't have waste and that you were targeting where you needed to invest your money. Your human resources, you know how long it takes to train a doctor and a specialist. What was the lead time in these things, and how did we ensure that we were networking and communicating with other agencies to ensure that our people were being trained? We cannot do anything without health information. Evidence base is key. Therefore, we had our information system outlined. Continual infrastructural development was also a factor, and drugs and pharmaceuticals. So when you speak about universal healthcare, you have to put universal healthcare in the context of a strengthened health system. Otherwise, you cannot sustain it and you cannot do it. Now, I hear there's a big debate between the universal healthcare and the national health insurance. National health insurance is just a financing strategy. It's just a financing strategy. What Dr. King was discussing earlier is a strategy to keep our people well and to sustain that level of wellness in our country. And this is the difference. And this is what we will hope that people will understand